Hello my diet tribe, welcome to another video session of Let's Talk Diabetes with Nkiruka. So today we're going to be talking about other factors apart from food that affect your blood sugar levels. When I was much younger and new with my diabetes diagnosis, I think even up to my late teenage years, I always used to focus on food as the only culprit that would make my blood sugars go up. But now I know better. And today I'm going to be telling you about the other factors that can affect your blood sugar levels. Like we all know, high blood sugar levels in persons living with diabetes can be caused by several factors apart from food, which I had just mentioned. But with proper management, these triggers can be identified and blood sugar levels monitored closely with treatment plans adjusted with your healthcare professionals. So what are the other factors that could affect your blood sugar levels? They include one, physical stress. So the kind of physical stress we are looking at, you can call them blunt traumas. So for example, we've got stress hormones. Like when you're really stressed out, your body releases stress hormones, and these stress hormones are counter-regulatory to insulin. So when the stress hormones are released, insulin doesn't function the way it should function, and in turn your blood sugar levels go sky high. And then the second factor that could cause physical stress is when you're ill. So when you're ill, your blood sugars tend to rise. The second one is emotional stress. So when you're anxious or you're depressed, you tend to secrete all these stress hormones again, like I previously mentioned, and this impacts on your blood sugar level. When you've taken insufficient insulin or oral diabetes meds, this also causes your blood sugars to go up. And over time, when your body is used to a particular type of medication, you tend to develop resistance to that medication, and this causes your blood sugars to go up. Lack of physical activity also makes your blood sugar go up. Hormonal changes, this is mostly seen in females. So when females are in their menstrual cycle, this causes blood sugars to go up. When women are pregnant, this causes both the high and the low blood sugar levels. And when you're in menopause as well, this causes blood sugar increase as well. Dehydration. So people living with diabetes, you need to keep yourselves well hydrated. If you're dehydrated, your blood sugar levels go up. And then the dawn phenomenon. Oh my goodness, this dealt with me. So this usually happens as a result of early morning rises in blood sugar. So this is a natural occurrence. So your natural hormones during sleep time also cause your blood sugars to go up. Sometimes I wake up in the morning with very abnormal blood sugar levels, and I'm like wondering what happened. I went to bed with a 5.2. I should be waking up, even with my basal insulin, I should be waking up with very good blood sugars, like maybe at most 6. But it doesn't happen like that all the time. Sometimes the dawn phenomenon happens and I end up with high blood sugars in the morning. But I don't let this hold me down because I already know the cause of it. This is something that every person living with diabetes cannot help. You will experience it sometimes or most times. And then for people who consume alcohol or certain medications, this could make your blood sugars go up. Like the certain medications I'm talking about, people who are on beta blockers or thiazide diuretics, these are blood pressure medications. They could also have counter regulatory effects on insulin sensitivity. So you have to keep that in mind. And for people who are on insulin, if you take alcohol, this, depending on the volume of alcohol consumed, it could cause a hypoglycemia or a hyperglycemia. And then people who have underlying conditions such as hyperthyroidism and PCOS or pancreatic disease, this could also lead to increase in your blood sugar levels. And then we have the counter-regulatory hormones, which I have previously mentioned. So stress hormones, cortisol, and the likes, they impact negatively on blood sugar levels. So they cause your blood sugars to go up. And improper insulin absorption. I've spoken about this in one of my earlier videos where I talked about insulin injection sites. So for people who take insulin, if you don't rotate your injection sites, what we call lipohypertrophy happens, and this makes the insulin that you inject in that particular spot not to be absorbed properly. So when you eat and you have given your injection, you've calculated your insulin to carb ratio, and you're thinking, oh, I've taken the right dose, but why are my blood sugars still high? These are one of the issues that are responsible for the reason why your blood sugars still remain high even after you've taken insulin. So for persons using insulin, you need to rotate your site. So each time you're taking your injections, take it in a different spot so that you allow the area that you have used previously to heal up. So remember, you like, subscribe, and you hit that notification bell for more interesting videos. I'm really loving these videos. Oh, so I'll see you guys in my next video. Bye.